most all of our lives have been touched in some form or fashion by mental illness, and that's why we think that today's discussion is so critical to our community health in general. Back in November, our news program at KLRU, Decibel, did an entire half-hour special on mental health. And we want to begin today's discussion with one of our panelists, Karen Reynes, who is the Executive Director of NAMI Austin. And we asked her to list some of the major myths surrounding mental health. So we want to start with that. Take a look.
There are 5 common mental health myths that we just have to talk about. Hi, I'm Karen Reynes, and I'm the Executive Director for NAMI Austin. NAMI is the National Alliance on Mental Illness, and we're the local affiliate, providing all kinds of free classes and support groups for families and individuals living with mental illness. The first mental health myth is that mental health issues aren't common. The truth is, 1 in 5 people in the United States and actually globally are impacted by mental health issues every single day. It's a lot more common than we realize. And the reason we don't realize how common it is because we don't talk about it enough. The second mental health myth is that mental health issues are caused by character flaws or personality weakness.
You are entering a new world of health care.
The truth is, mental health is a public health issue. I love what the World Health Organization says, which is there is no health without mental health. These are brain health issues that impact lots of people, and treatment does work and recovery is possible. The third mental health myth is that kids don't get mental illness, when the fact is that actually mental health issues are as common among children as they are with adults. The numbers are the same, 1 in 5. And in fact, lifetime mental health issues show their signs by age 14. The fourth mental health myth is that people don't get better. The truth is, mental health treatment does work and recovery is possible. We see it every single day, and we know that the success rates are very similar to physical health issues. The right treatment, access to medication, therapy, a great support system, people can and do get better. The fifth mental health myth is that mental health issues aren't life-threatening, when in fact what we know is about 90% of suicides in our community are caused by either untreated, undertreated, or undiagnosed mental health issues. Suicide is on the rise, and so it's really important that we pay attention to mental health issues so we can save lives.
We thought that would be a good framework to start our discussion because we all want to end a lot of the myths and stigma associated with mental health issues. Before we do get started, I do want to take a moment to correct an error that was sent out in the Leadership Austin Engaged Breakfast email. It stated that 1 in 2 children are diagnosed with mental illness by age 14. The more accurate statement is that 50% of all mental illnesses occur by the age of 14. And you should have noticed an update in your most recent communication from Leadership Austin. Well, our goal at Decibel, you just saw a taste of our work there, but we are KLRU's news division, and we want to cover issues that really matter to the community, and certainly mental health is a key one. Our partnership with Leadership Austin makes total sense to us. We are often covering the very same issues that Leadership Austin is during these engaged breakfasts. We have a quick reminder for you, and that is we are live streaming on our Decibel ATX Facebook page with KLRU, so if you would like to share that, we hope you will via social media, because that's a great way to raise the awareness and raise the profile of these discussions. If you want to text in a question, We call this Engage Breakfast, and we want you to engage and ask questions. The directions are there, right there on your screen. You text the questions to 22-333. And Courtney Bailey, if you could wave. Courtney is Leadership Austin's Director of Issues and Engagement, and she will be your voice essentially this morning, taking in those questions and asking our panel members. Now I want you to meet our illustrious panel. As I said, I've met several of them and worked with them, and I think you're in for an education like no other when it comes to mental health issues in Central Texas. First, we have Karen Reynes, who you just met, and as we mentioned is the Executive Director of NAMI Austin, which is a group that really strives to transform how people view mental health in our community. Next, we have Courtney Robinson. Courtney is the founder of the Excellence and Advancement Foundation. This provides services to break that school-to-prison pipeline and create new paths for children at risk of becoming involved in our criminal justice system. And we have Michelle Pearson. Michelle is a licensed clinical social worker doing that groundwork every single day. Currently, she's working as a school-based therapist with Integral Care within the Del Valley Independent School District. Then we have Tariq Daniel, who is the founder and executive director of What's in the Mirror. This is a social movement that provides mental health awareness and suicide prevention through art and advocacy to communities of color. And finally, down on the end, we have Brandy Hart. Brandy's the Chief Administrative Officer at Seton Shoal Creek Hospital. And as many of you know, this is a behavioral health hospital that provides mental health and substance use services to both children and adults. So thank you all for giving us your time this morning. I want to begin with just a general question for everyone. And that is, what led you as individuals to want to tackle this particular community issue? That's the first thing. And then what are you hoping that everybody else out here gains from what you have to deliver today to us? So what led you to tackle this issue, and what are you hoping we gain from the conversation? And I'll just go down the line. Karen, if you'd like to begin.
Thank you, Judy. I think for me, while I have the wonderful gift of being the executive director for a great organization doing all kinds of work in the mental health field in our community, honestly, I'm here today and I've got this name tag on largely because I'm a mom. And about 8 years ago, I almost lost my own teenager to suicide. And that very much has been the driving passion to do this work. And then secondly, I think my great hope for today's conversation is that all of you walk away today equipped with great information, ideas about resources, and the inspiration to go out and have some conversations, just like Dr. Garcia talked. How do we create safe spaces for all of us to have positive and proactive mental health conversations?
Good morning. I would say what led me to this work, particularly the school to prison pipeline, is that my father was incarcerated when I was 6 months old and he was 18 years old. So I'm really impacted by youth and how they find their way into the criminal justice system. And often in that work, we find that children have experienced adverse situations and their mental health is challenged and has gone untreated, underdiagnosed, and we really believe that this work is critical and important to how we transform, how communities combat the school to prison pipeline. And the second question was?
What you're hoping we gain.
What we hope we gain. Okay, so I hope that people gain knowledge, but I also hope that you feel a call to action, that you will think about where you spend your resources and your time, and think about putting those resources and time towards organizations that are doing the work on the ground.
Great. Michelle?
Good morning. First of all, I just want to say I'm so grateful to be at the table because it is wonderful to be doing this work and see so many people that are interested in talking about this very important issue. I think what keeps me involved with this important issue is just seeing that there is so much hope in kids. I think we're all here because we know that recovery is possible, and that despite the adversity, I think what we see a lot in Del Valley is, kids who've been impacted by trauma, issues of domestic violence, and what comes with living with poverty, and just all the challenges that they face. And families are resilient, but I think what keeps me excited about doing this work is seeing that there is hope in it, and to see the light come back in children's eyes despite what they've been through. And so that definitely keeps me in this work. And then the second part of the question, I would say just keeping this at the forefront. I think it's important, we are the voices of these kids, making sure that they get their needs met and that programs that are doing this important work are well funded, because my only wish out there is there was just more of us. Many of us are in 2 and 3 schools, and ideally we'd be in one school, and ideally there'd be more than one of us in each school because there is such a need and it is important work.
Tyreek?
Good morning, everyone. I think one of the main reasons why I got into this work and why it's important is that my little sister is a 3-time suicide attempt survivor, and I never knew. It was something that she was ashamed to talk about with our family, and that just made me really want to get into the work of awareness and in the stigma, because if my own sister was ashamed to talk to us about it, then I know that there's a lot of other people out there that's ashamed and dealing with the stigma. And what I want you guys to get out of the conversation from my perspective is just to look at mental health from a cultural responsiveness. We can't treat mental health the same for everyone. We have to be mindful of backgrounds, sexual orientations and everything else that leads to the whole person. And so that's what I really would like for you guys to get out from my perspective of this conversation.
Good morning. Everyone has a great story about how they get into their career path or field. Mine is no different, but really mine comes from a place of personal awareness. Every one of us at some varying level has their own bag of issues. Sometimes we live in a state of denial where we don't want to acknowledge it, or we're scared to talk about it. I was called in coming from a family who struggled just like everyone else, and wanting to give everyone a voice, to normalize it, to talk about it in a platform where it's not stigmatizing, and to create an environment where people can get care, personalized care, safe care, when the need arises. And so I've worked in a lot of areas to be able to deliver that both individually as a counselor and then as an administrator. What I hope you all take away is that, just like my reason for getting in, is that we all have mental health. It is a part of who we are. And I hope that by learning more about issues that our adolescents and children are facing, that you can help normalize the conversation, that you can start it at home, or be able to normalize it within yourself, and then how can you be an advocate in the community that you're in to help promote those conversations early and avoid crisis situations and really intervene.
I want to spend a little time on audience questions, but before we do, I have one kind of overview question, and that is how well our community is doing addressing these mental health incomes. Karen, do you have information on like what does the data show? How are we doing as a community? Are we doing better than most cities or not so great?
Yeah, well, I think certainly we're fortunate to be in a community where we have some great resources. You have a robust NAMI affiliate, you've got Integral Care, you've got a number of psychiatric hospitals, so certainly we've got some resources in our community that you might not find in others. But I think when you look at the data, what the data tells us is we are right to be concerned, and we are certainly right to want to create change in our communities. So as you saw in that video, it mentioned the fact, and you brought it up as well, that 50% of lifetime mental health issues show their signs by age 14. The follow-up to that is the fact that there is an 8 to 10 year gap between the onset of symptoms and treatment. Imagine all the things that happens in those 8 to 10 years. 70% of the young people in our juvenile justice system have some underlying mental health issue, and that's certainly not a place where they should be receiving treatment for that. We know that suicide is the second leading cause of death among ages 10 to 24, and only to accidents. It's second to only to accidents. And then we also know that in the state of Texas, in 2017, our kids reported that they had almost double the rate of attempted suicides than the national average. So there's a great deal of concern there around that, and we know that here locally, Integral Care has reported that on their crisis line where they receive calls, they've seen a 40% increase in the number of calls they're receiving needing access to help for their kids. So certainly we know that that's the case. The good news is, again, that there's I think it's important to recognize that in our community we have many of the folks sitting here on this panel and beyond who are actively engaged. There was a task force that Integral Care facilitated last year that's continuing the work of really looking at children's mental health and the crisis piece of it and how to address that. So there's a lot of good work being done in that community. Your awareness of that will be really important so you can help advocate for the kind of change and funding that is often required to make that change possible.
Anyone else have some personal observations about how well you think our community is addressing mental health outcomes for young people? Anybody else have a...
I think I know one of the things we see a lot in schools. We, unfortunately, in the last month, had a 6th grade student who died by suicide. And by the next day, many of our students knew about that via social media. So what we know is they don't have the tools to process that. And many families don't have the tools to be able to talk about that. And so I think it's really important. We do have kids that have access to information in a way they've never had before. And so helping them, making sure they have the education and tools they need to be able to make sense of really adult content oftentimes is really important. And so I think that education piece in schools with families in the community is really, really important.
Courtney, do you have some questions from the audience?
So, is it on?
That's our non-working mic.
Okay. So how do we as individuals get the leadership in the community to engage and change policy in favor of more mental health care?
Boots on the ground kind of stuff. How can we accomplish that? Anybody? Go ahead.
I think there's a variety of different ways that you can become engaged. One, it's using your voice, and there are lots of ways that you can do that. In order to use your voice, you must have knowledge to back your advocacy. So learning about initiatives, learning about the services that are offered within the community or the lack thereof, which is sometimes the case. Going to your political leaders, your school leaders, your faith-based leaders, and sharing your voice with them and advocating for those resources. Sometimes using your personal story as a means of advocacy is really strong, but not being afraid to speak out.
I would agree with Brandy in that so often I know we're doing a lot of work in schools, and sometimes parents will ask us, well, why haven't you come to whatever their school where their kids are? And it's like, well, we have to get an invitation. And the reality is we can do the outreach, but we do find sometimes that schools are resistant, and a lot of times it's that fear that if you come in and you bring the information that somehow you're going to make kids think more about mental health or suicide. And so there's a fear there. And so I know we often say to parents, you have to be the one to advocate in your local school to say, we want more resources and education and support in our schools. The other thing I'm going to challenge you to do is to get educated. And if you're talking about youth mental health, one of the best things that you can do in the next few days is go to Integral Care and search for the Children's Mental Health Task Force. And you will find this document. You may not want to actually download it and print it, but you can certainly read it online. But this is the work that the task force that Integral Care has facilitated. This is the work they've been doing. There's recommendations in here. Become educated about what the needs are and where the gaps are, and where this task force has really looked at, here's the next steps we could take as a community so that you can, from a place of knowledge and integrity, know what the gaps are and be able to communicate it well.
And I think one of the, this question is based around leadership, and this segues nicely into the, we're nearing the end of the Texas legislative session. And one of the topics they've been talking about is whether mental health services can prevent school shootings. So earlier this year, Senate Bill 10 was filed by Senator Jane Nelson, and this is a bill that would create Texas mental health care, a consortium of sorts. This is a $100 million initiative. I don't think it has long legs right now. I don't know if it has passed. Is anybody? I don't think it has. I think I would know. But what do you think about this particular bill, and in general, the question, that Courtney asked, what are ways we can, the people that are making these massive decisions about our children's lives and their mental health are, a lot of them at the Capitol building or in our city halls. How can we get that message to them?
Well, I mean, when I look at the bill and read about it, I don't see anything about mental health services. And the idea to really connect mass shootings to the work of mental health is kind of like a scary approach to me, because we already have the stigma of mental health, And so just reading over the bill, I feel like that's going to put fear into the people that's dealing with mental illness, and then the idea that mental illness is the only just the only contributing factor to mass shootings. I feel like if we really want to put that kind of money into a bill to try to reform mental health in the state of Texas, we need to do the groundwork. How can you create all these task force and all these committees in schools to talk about mass shootings, but we're not putting the same effort into mental health services? So instead of just putting a telephone in the classroom, we need to make sure that every school is doing the right work to deal with bullying, doing the right work dealing with counseling, making sure that there are not 2 or 3 people working in one, doing one person working in 2 to 3 schools. So I think the bill has is kind of tricky, and I feel like
it might lead to more stigma.
A lot more stigma, because mass shootings is a rare occurrence, and it's happening more, right? So it's not something that we should ignore, but that shouldn't be the forefront of what we're going to look at as a mental health reform in the state of Texas, in my opinion.
And I think we have to be and I think we have to be careful when we're talking about legislation. I mean, when we think about let's take Brown v. Board, 1954, we were using it to end racism. We can't use legislation to end gun violence or to deal with the issues around gun legislation. And so I think we have to be careful with this kind of legislation. So I agree with Tariq in that we can't just blanket a piece of legislation. It's really about policy and practice, and how are we doing the work in the community, and what does that look like in terms of boots on the ground and the people who are actually participating in recovery. And so services are very, very important, and so I think that having the resources and funding is important, but I think we have to be really, really careful about putting gun safety and mental health in the same basket.
Myth number 6 is that people living with mental illness are violent. The truth is that only the correlation there is about 4%, and in that 4%, what you almost always see are people who are living with untreated, undiagnosed psychosis. I think if you pay really close attention to the concerns that we have around mass shootings, what you tend to see more is issues around people who are really isolated, who've encountered bullying, which I think is the biggest issue of violence that our kids are facing every single day. We should be more concerned about that. Dating violence, another huge issue. Self-harm, another huge issue. So if you want to look at violence, those are the issues we need to be paying attention to. And then we've got to really focus on this focus on intervention and prevention and creating those safe spaces that we talked about, and making sure that, honestly, instead of hardening our schools, we need to be softening them a little bit.
Yes, and if I could add to that, I think, one of the things that we're doing in schools, in changing that culture and really making it a little more trauma-based classrooms, in the sense that we are recognizing what triggers children who have been through trauma, and we are helping teachers understand, what types of strategies to use to help it be a safe environment. I do think, we're really trying to change the culture of schools, because I think there is a lot of fear and misconception around mental health, that it's something that kind of happens off in the distance and it's scary. Where I live, which is off in the suburbs, we recently had a teacher that died by suicide, and it really rocked our community because people were just not well-versed in talking about mental health and how important it really is. So it impacted all our teachers and our students, and I felt that people just struggle for the language. And so I think it starts with us, educating ourselves. We have, a mental health first aid that Integral Care provides, where we can just even talk about the basics of how to recognize when we're concerned about people. And, we're talking to kids about when you're worried about a friend, what needs to happen? Who can you go to really make sure we're kind of taking care of one another and watching each other, because it's our responsibility to care for one another. And so we're teaching on that level what to do and how to recognize those signs when someone needs support.
And after watching you in the classroom, I wish that we could just clone you and have you in every
Oh, so do I. I
in
wish
all of the schools.
Myself and my coworkers, that's what we wish for, is more of us out there.
But that's a money issue, and I have a question for you, Brandy, because it deals with money. So what are the current trends and costs for behavioral health and psychiatric care for children? Because they've got to be rising, right?
Wow, I'm scared to open this can of worms.
That's all right. That's why we're here. This is a safe space to talk.
I'll begin with, you all are probably personally aware of the changes with healthcare and the impact that has on the family. Texas is one of the highest uninsured populations due to lack of access to affordable health care. Additionally, Texas did not participate in the Medicaid expansion plan, which changed our ability to offer additional services under Medicaid, which many children in the state of Texas are insured under our Medicaid plans. Even when you are able to be insured either through private insurance or through a state or federal plan, it's often difficult to find providers. The reimbursement for mental health services is certainly not equivalent to reimbursement even for medical care. We talk about parity, but really it's a separate but equal, not quite equal scenario when it comes to resources to fund mental health services. Because of that, many providers within the community, those that would provide those initial preventative interventions such as counseling or psychiatry on an outpatient basis, often do not participate as plan providers with the managed care plans. And so then families are challenged when resources are scarce to be able to afford to access counseling services or psychiatric services that can be preventative and work to address issues before a crisis arises. So what happens then is an individual ends up in a crisis situation and the most expensive intervention is required, and that's an inpatient hospitalization, which can cause thousands of dollars of financial burden to an already taxed family. When we talk about students or